Why does indoor cycling cause perineal pain? Imagine pushing your limits on a stationary bicycle, feeling the burn in your legs and lungs, but suddenly noticing discomfort in the area between your genitals and anus. This sensation, known as perineal pain, is a common experience for many indoor cycling enthusiasts. Understanding why this occurs involves exploring the anatomy of the pelvis and the mechanics of riding a stationary bike. The perineum is a region that contains muscles, nerves, and blood vessels supporting the pelvic organs. When you cycle indoors, especially on a bike that is not properly adjusted, your body weight is often supported primarily by the saddle and the perineal area. If the saddle is too narrow, too hard, or positioned incorrectly, it can exert excessive pressure on the soft tissues in this region. This pressure compresses the perineal nerves, particularly the pudendal nerve, which supplies sensation to the genitals and perineum. Prolonged or repeated pressure on these nerves can lead to numbness, tingling, or even pain. Additionally, the design of many indoor cycling saddles tends to favor support for the sit bones, which are the bony prominences at the base of the pelvis, but often neglect the soft tissues in the perineal area. This imbalance increases the likelihood of nerve compression and discomfort during extended rides. Another factor contributing to perineal pain is riding posture. When riders lean excessively forward or arch their lower back, they shift more weight onto the saddle and the perineal region. This position amplifies pressure on the soft tissues and nerves, especially if the handlebars are set too low or too far away, forcing the rider into an uncomfortable angle. The duration and intensity of cycling sessions also play a role. Longer rides without breaks allow continuous pressure on the same tissues, increasing the risk of nerve compression and tissue irritation. Proper bike fit, including saddle height, tilt, and for aft position, can significantly reduce this pressure. Using saddles designed with cutouts or channels to relieving pressure on the perineal area can also help prevent discomfort. In summary, indoor cycling can cause perineal pain primarily due to pressure exerted on soft tissues and nerves in the pelvic region. Factors such as saddle design, riding posture, bike fit, and session length all influence the likelihood of experiencing this discomfort. Being mindful of these elements and making appropriate adjustments can enhance comfort and allow for more enjoyable cycling experiences.